Hello from Geneva. I'm Anabel González, Deputy Director General of the World Trade Organization, and I'm very pleased to welcome you to this technical symposium on COVID-19 vaccine supply chain and regulatory transparency. The WTO has been actively working on trade and public health related issues since 2001, when members adopted the Doha Declaration on Trade Related Intellectual Property Rights and Public Health. Over this time, the WTO has promoted a comprehensive and multidisciplinary approach, which has entailed strong partnerships with other international organizations. As part of this continuous collaboration at all levels, we are privileged today to welcome my colleagues, Dr. Mariângela Batista Galvão Simão, Assistant Director General for Access to Medicines and Health Products at the World Health Organization, and Mr. Ricardo Treviño Chapa, Deputy Secretary General at the World Customs Organization. Our objective today is to improve public and policymaker understanding at the technical level of the operation of global COVID-19 vaccine and input supply chains. We will also look at the role that trade policy can play in facilitating the cross-border movement of vaccine inputs, as well as the critical role of regulatory transparency and cooperation to secure equitable access. We're conscious that policymakers across the globe are wrestling with pressing practical issues as they seek to map their way through the COVID-19 shock, and we're working with a wide range of partners to play our role in creating a sound, inclusive, and timely information base to support critical policy choices. Trade has been a positive force during the pandemic by enabling access to much-needed medical supplies around the world. Even as the value of global merchandise trade shrank by more than 7% in 2020, trade in medical supplies increased by 16% and by 50% for personal protective equipment. Trade is a tool that can be leveraged to facilitate access, and WTO members have acknowledged this and have made several proposals related to trade and public health aimed at facilitating trade and access to medical goods. Delegations are actively engaged in discussing possible elements for inclusion in a deliverable at the 12th Ministerial Conference later this year. This is important as a strong multilateral trading system contributes to create a fertile ground for global recovery, resilience, and preparedness. Today, close to 30 economies are projected to produce COVID-19 vaccines by the end of 2021, with 16 of these economies outside of the G20. We owe it to the billions of people who have not been vaccinated yet to do everything to ensure that the cross-border movement of vaccines and the inputs necessary to produce them is as smooth as possible so that vaccine manufacturing can meet these demands. The WTO can contribute in different ways to ramp up production and foster vaccine equity, including but not limited to supporting efforts to identify and reduce export restrictions and to put trade facilitation measures in place, fostering cooperation and partnerships, including through voluntary licensing and technology transfer, as well as the effective implementation and use of policy options available in the WTO system, monitoring trade policies and ensuring transparency, contributing to building the capacity of regulatory authorities that need to ensure the safety, quality, and efficacy of vaccines and other medical products, and promoting the collection of granular trade data in support of facilitating vaccine manufacturing and supply chains. Dr. Ngozi has called on us all to meet the challenge of vaccine equity. She has unambiguously articulated the role that she sees trade is playing in this process. I trust today's technical symposium will generate important insights and feed into continuing efforts to identify and overcome bottlenecks in the vaccine and input supply chains and other critical technologies. I trust it will also lay the groundwork for increased cooperation to find practical solutions to scale up the global COVID-19 response and address gaps in the global production and distribution of vaccines, personal protective equipment, and other medical technologies. To make the most out of our time together, I will leave it to you to consult the program and the biographical data for the impressive slate of speakers who have kindly agreed to take part today, and thanks to them all. You may find this on the WTO website. With that, let me pass it over to our first speaker, Dr. Mariângela Batista Galvão Simão, WHO Assistant Director General. Mariângela, the floor is yours.
Thank you very much, Anabel, and congratulations on your appointment. It's very good to have you in WTO in this position. And good morning, good afternoon, and good evening to all. I'm going to put a few reflections on the table because this COVID pandemic has reminded us all with staggering force what happens when essential health products are not sufficiently available and equitably distributed. And this has to do with supply chains, but it has to do with many other factors as well. We are living through the harsh reality of an extreme inequity in access to vaccines, where there are countries with more than 70% vaccine coverage, while in many low-income countries, vaccine coverage can be as low as 1.5%. And for some of us who've been working on access for a longer time, it's a déjà vu situation. The response to HIV should have been a lesson learned because it took more than 10 years for effective treatments to reach low and middle income countries. And one of the reasons for this delay at the time was that the high income countries were concerned about lack of absorptive capacity in these countries. And this is very similar to what we are beginning to hear during this pandemic. This is, of course, a very controversial issue, absorptive capacity, because it should not keep countries last in line. And this includes the supply chain fragilities, and it should not delay actions to address urgently the coverage gap between high-income countries and lower and middle-income countries. In the HIV field, this delay costed tens of millions of lives. But as it was a chronic infection, these deaths were spread across the years. And the generic industry actually played a big role in helping expand the HIV treatment. This SARS-CoV-2 pandemic brings us different context, very different, because we have a highly transmissible respiratory virus, and one that, besides the pressure in the health system, also has an enormous economic impact, and it's affecting lives of individuals in entire society. And then science tells us, this is a time for science to come and tell us the way, right? Science is telling us that there are variants of concern, there are more transmissible, and that could have negative effects in the immunogenicity of vaccines. So we have no time to lose in increasing vaccine coverage to more equitable levels in all countries. Just a few weeks ago, the World Health Assembly adopted a landmark resolution on strengthening local production. You are aware of that, and strengthening of health regulatory systems go hand in hand with increased manufacturing capacity. There will be later on today some discussion about this. And the good news on the vaccine field is that we do have a developing countries vaccine manufacturing network, and there are many vaccine producers in developing countries that have pre-qualified products with WHO. DG Anabel has mentioned voluntary licensing. WHO is pushing for voluntary license and sharing of know-how and technology together with 43 countries with the CTAP initiative. And you are also aware that WHO issued a call for expression of interest to establish technology transfer hubs for COVID mRNA vaccines. WHO received more than 50 proposals, half of which are from companies or institutions interested in receiving the technology, and half in providing technology or acting as a training hub. Both initiatives, actually, CTAP and the Vaccine Manufacturing Task Force, do need the industry to come on board, and the technology holders, the IP holders, to come on board to make these initiatives to expand manufacturing across the globe a reality. And I must say that the active engagement of WTO at the highest level, with Dr. Ngozi at the helm, in pushing for greater access to COVID products, is very welcome by WHO, as is the organization of this technical symposium on vaccine supply and supply chain and regulatory transparency. To close, we must ensure that information sharing during this symposium can result in actionable and achievable contributions from industry, governments, and other stakeholders alike. And WHO stands ready to support the collaboration together with WTO. Thank you very much, DDG Anabel. Over.
Thank you very much, Mariângela, for your very important remarks, as well as for that call for action. I now would like to offer the floor to Ricardo Treviño Chapa, Deputy Secretary General of the WCO. Ricardo, you have the floor.
Thank you very much, and good morning. Good morning to you. I'm talking to you from Brussels, Belgium, here where the headquarters of WCO are. And I want to thank, first of all, the WTO for the invitation to this symposium. It has been a very important set of events, starting on the 14th of April with the WTO event on COVID-19 and vaccine equity, in which WCO also participated. And with this symposium, I think we're following up on some of the discussions that were held there. I greet, of course, Dr. Mariângela Simão as well from WHO, whom we have been working very closely as well. And I join her in congratulating you and wishing you the very much successful way forward in WTO, Deputy Director General Anabel González. It's a pleasure to greet you from here and congratulate you as well. In WCO, we are, of course, the international organization 100% focused on customs matters. And of course, as customs being a very important part in the supply chain of the international trade infrastructure, we have been playing an important role in facilitating and securing the cross-border movement of medicines, vaccines, and related supplies and equipment, of course, particularly vaccine manufacturing inputs and components. As the voice of international customs community, we have undertaken several actions to support our 193 members in facilitating the cross-border movement of relief and essential supplies, and to support the economy and sustain the supply chain continuity. Immediately after COVID-19, vaccine candidates demonstrated high effectiveness in phase 3 in clinical trials on December 2020. The WCO Council, which is our highest decision-making body, unanimously adopted a resolution on the role of customs in facilitating the cross-border movement of situationally critical medicines and vaccines, including measures for our member customs administrations and, of course, concrete actions for the WCO Secretariat to carry out. So immediately after the adoption of this resolution, we took a number of steps to implement it. We developed a COVID-19 action plan containing 25 concrete actions that has led us to operationalize this resolution, because as Dr. Mariângela Simão just mentioned, we have to take into action what we are talking about. And in this case, there was a high-level resolution agreed by our council. However, we needed to implement it, and we took it into these 25 concrete actions that have been, or that will cover 18 months in total. So we're planning for 1.5 years of concrete actions, focusing as an overarching priority within WCO strategy to support the distribution of vaccines and other medical equipment. We developed dedicated guidance materials within these 25 concrete actions. For instance, the Harmonized System Classification Reference for vaccines and related supplies and equipment. And also, we published a note on the role of customs in facilitating and securing the cross-border movement of situationally critical medicines and vaccines. We also established a repository of members' good practices in facilitating the cross-border movement of COVID-19 vaccines. This is available in our website, and it's for open consultation for our members, for other stakeholders. And we also have been signing several MOUs and joint statements, working closely with other colleagues from other international organizations. For instance, one of the latest would be with ICAO, in which we signed a joint statement calling for open collaboration between the aviation and customs communities, as well as those responsible for other transport modes and other relevant stakeholders, in order to ensure, again, safe, secure, and efficient transport of vaccines and associated equipment across the borders. Of course, the issue of the cross-border movement of vaccines and related medical supplies and equipment is subject to regular discussions as well with other stakeholders. We've been meeting very frequently with our private sector consultative group. And in this working body, we share information about challenges, good practices, and possible solutions in which WCO and customs community can contribute. So we are very close contact with the private sector as well, in listening to any problems that they can identify and challenges to ease the distribution of vaccines. We have organized a global webinar series to improve members' awareness on the essential characteristics of different COVID-19 vaccines and the respective supply chains. So this is as well on our role as customs, not only in the part of facilitation, but we have, of course, our role as compliance. So we aim to facilitate trade, but we are talking about, of course, legal trade. And therefore, we have our role as well in detecting fraudulent and illegal trade. Therefore, we have organized webinars so that we can identify the characteristics of each of our vaccines, so that we can easily identify which ones are the real ones, and also be protecting society from possible harmful vaccines or other medical equipment. And we have, of course, provided information to identify the genuine vaccines and medical supplies being shared through our platforms regarding as well our intellectual property rights programs. And therefore, we look for pre-arrival information in which we can therefore implement our risk management so that we can be effective in, as I said, allowing the flow of legal vaccines and facilitating the distribution of these important medicines. But we also need to be very conscious that sometimes organized crime is also trying to benefit from these facilitation measures, and we have to be very, very alert on possible fraudulent actions. And therefore, that's why we launched as well recently on the 30th of April, the biggest, the largest until now enforcement operation, which has been named Operation Stop 2, which benefits from the participation of more than 140 countries of our members, of course. And we also are working together in this global operation to identify illegal vaccines and medicines together with Interpol, OLAF, UNODC, of course, World Health Organization, and Europol. This Operation Stop 2 targets counterfeit, substandard, and illicit medicines, medical supplies and equipment, and vaccines related to COVID-19, and gives special attention to small consignments and electronic commerce as well. As you know, e-commerce has been growing before pandemic and throughout the pandemic, but unfortunately, the supply chain of e-commerce is also now being used for some illegal trade. So we have to be very much alert on that side. Now, with regard to the vaccine manufacturing inputs and components, so far our consultations with the private sector consultative group have reported in the last few months that bottlenecks have been solved. We have no bottlenecks detected due to customs at this point. We are aware that export restrictions, of course, are a major impediment to the vaccine distribution, and therefore we have published guidance materials and we have called and advocate for efforts with our members so that they can take facilitation measures and they can lower any export restrictions. Also, we have worked very hard in linking our tools, such as the harmonized system. Here in session 3, we will have the participation of our Deputy Director of Tariff and Trade Affairs, Ms. Gael Gruby. She will give much more detail that I can at this point on what we're doing on this work for helping, of course, the supply chain of distribution of vaccines. However, I just might say that the harmonized system classification reference for vaccines and related supplies and equipment was developed in cooperation with World Health Organization and supports customs administrations and economic operators in classifying vaccines and the related supplies and equipment at the international level. That is 6 digits as per the current harmonized system, of course. This list, as well as the other lists of the HS codes developed by the World Customs Organization together with WHO earlier in the pandemic, were extensively used by our members for the purpose of prioritizing the clearance and relief of essential goods and equipment included in the lists. The lists of harmonized system codes played a role in the government decision-making processes on waiving import duties and taxes and economic import prohibitions or restrictions with respect to the goods on such lists. Now, the harmonized system classification reference for vaccines and related supplies and equipment contains some of the components required for the manufacturing and administering of the vaccines, such as vials, syringes, needles, but does not contain a comprehensive list of inputs and components required in the vaccine manufacturing process. So this is something that still we can keep working together with the industry. We will continue, of course, to actively engage in working with the WTO and WHO and manufacturers looking at the identification and facilitation of critical supplies for vaccine manufacturing. And we are very much active together with our members in doing this. And we remain open to expanding our cooperation with the pharmaceutical industry and all relevant international organizations in order to better understand the supply chain of the vaccine manufacturing inputs and components and support our members, support customs administrations in facilitating the cross-border movement of these inputs and components. Again, I want to thank WTO for organizing this event and inviting WCO to participate. And I wish that this event is very much successful. Thank you very much, Anabel. Back to you.
Thank you very much, Ricardo, for your words, and thanks a lot to you and Mariângela for joining us in this event. We look forward to continuing our strong collaboration with your organizations as we move forward in our work related to trade and public health. Now, let us move to our first session. I will pass the relay to Robert Koopman, Chief Economist and Director of the Economic Research and Statistics Division of the WTO Secretariat. Bob, the floor is yours.